Welcome to the University of Hartford's Department of Physical Therapy. In the following video, we will watch a motor control case study involving a patient with cerebral palsy. Sue is a 10-year-old girl with spastic diplegia cerebral palsy. She is moderately involved and classified as a level 2 on the Gross Motor Functional Classification Scale. She lives in a 2-story house with her mother and 5 older siblings. Sue likes to play the piano and hopes to one day play kickball at school with her friends. Sue receives physical therapy 5 times a week and has shown improvements. Her current concerns are her walking ability and balance, as she reports falling a couple times a week. As with most patients with cerebral palsy, Sue has several factors contributing to her functional abilities. She has restricted range of motion in her hips, knees, and ankles. This impairment comes secondary to primary impairments, such as spasticity and weakness of her lower extremities. This forces Sue to walk with a somewhat crouched gait and lands on forefoot at initial contact. She also has poor foot clearance in swing and walks with an asymmetrical gait pattern. Let's take a look at a few of her treatments and how they relate to the theories and concepts of motor control. Sue also has poor postural control, as she demonstrated on the functional reach test. This test is a valid and reliable assessment tool for balance that is simple, cost-effective, and clinically useful for evaluating balance during the common functional maneuver of reaching. This is a great way to objectively quantify progress. Sue's poor balance is due to a lack of proprioception and poor vestibular function, as demonstrated on the foam and dome test. It is important to educate Sue on the use of her vision when maintaining balance. Having Sue fix her gaze on a distant object is a great way to maintain balance. It is important to challenge her deficits in order to improve function. Here you can see her proprioception is being challenged by standing on a foam surface. Maintaining gaze on a distant object during this activity can be beneficial. One way to challenge her vestibular system is to change her direction of gaze by looking at various objects around the room while rotating the head. Instruct Sue to look at each object for 2 to 3 seconds, then challenge her by telling her to look at a different object. Challenging these systems will help to prepare Sue for more practical everyday situations. Once Sue has shown improvements in both her proprioceptive and vestibular functions, you can provide simultaneous challenges to further enhance her function. Have Sue maintain balance on a foam surface while randomizing the order of object to look towards. After several weeks of progressing balance treatments, it is a good idea to reassess functional outcome measures to objectively quantify improvements in balance. This is a good source of feedback to the patients and helps to increase motivation during therapy. The balance training in the clinic had a positive impact on her functional reach test. Sue also demonstrated a positive transfer outside the clinic, as she is now able to perform functional postural control. Sue can now safely and confidently reach for items around the house, including reaching for soap to wash her hands. The tug test is a valid and reliable test used by researchers and clinicians to assess a patient's mobility, balance, and walking abilities. Sue completed the tug test in 10 seconds, which is much slower than healthy children her age. This puts her at a moderate fall risk, making this a top priority for treatment. Sue's balance issues have already been addressed, which will help her with her walking ability. Because Sue is a fall risk, navigating objects will pose as a challenge for her. It is also important that Sue have the ability to navigate a variety of conditions, which will help to prepare her for practical situations outside of the clinic. Because of Sue's condition, it is a good idea to utilize the ecological theory of motor control. This theory states that motor control evolves by exploring the way in which our motor systems allow us to interact most effectively with the environment in order to perform a goal-oriented behavior. Due to Sue's restrictions and altered gait pattern, an important part of intervention is helping Sue explore the possibilities for achieving a functional task in multiple ways. When describing the task to Sue, provide her the goal of getting to the other end of the course and utilize discovery learning. Discovery learning is having Sue figure out the best way to complete the task. Because Sue has altered vestibular and proprioceptive function, it is a good idea to provide Sue with augmented feedback regarding her performance and results. This will help for her to make sense of her intrinsic feedback and ultimately make her more autonomous with the skill. For this treatment, set up various obstacles for Sue to interact with and use close guarding for safety. Utilizing the learning phenomenon called contextual interference, which is randomizing the type of objects Sue comes in contact with throughout the course, can enhance her ability. Research has shown that this type of practice resulted in better performance on both transfer and retention tests. When setting up the obstacle course, try to apply functionality with the obstacles. For example, try having her step up on objects that are curb height or walk on surfaces such as carpet. Find out where they are having difficulty and challenge them to be successful. As Sue progresses her performance and stage of learning, reduce the amount of feedback she receives. Self-selected feedback is feedback only provided when the patient asks for it. This decreases the dependency on feedback from the therapist. Studies have shown that patients perform more accurately on retention tests when they control the frequency of feedback. Utilize the tug test again to assess improvements with functional mobility over time. Providing Sue with the knowledge of her results will allow her to see just how much she has improved, increasing her overall motivation. Positive transfer of learning is the beneficial effect that occurs when previous experience facilitates performance of a skill in a new context or the learning of a new skill. Sue's practice of the obstacle course has shown a positive transfer to walking in an environment with many regulatory conditions. The transfer occurs as a result of similarity between the components of the two performance situations. She can now safely navigate the schoolyard to be with her friends.